cirrhosis and your postmenopausal, actually estrogens work very well. And the easy way of using that is a patch, because you tend to bypass the liver in terms of what we call the first pass metabolism. If you take a pill, it gets absorbed, goes to the liver before it gets into your general circulation. But the patch tends not to do that, so you have a lower level of estrogen getting to the active sites to help you with bone loss and other postmenopausal issues. So the patch is preferred if necessary.
We have a post-transplant question. Why are the reasons for survival for 5 years not higher than 85%?
Yes, the first year, the question is survival rate better than 85%. I think our program does better, but I don't want to show you that data. The key thing is that the first year, you most likely will have complications from technical issues. For example, the blood vessels that are being hooked up might get clogged, or your bile ducts might get clogged. And so if you survive the first year, the chance of you doing very well in 5 years is pretty good. But unfortunately, with the medications we use, the anti-rejection medications, it's a double-edged sword. We want to protect you from rejecting that organ. In the same fashion, you are set up for infections and cancers. So if you have a cancer that has not been diagnosed or is hidden, the anti-rejection drugs can bring it out, or infections can really come into play. So in those instances, we tend to get a little attrition after about 5 years, but after that, it really tails off. And most times, if you survive your first year, you do very well.
We have someone ask, you had mentioned in your slide about reasons that somebody would not be eligible for transplant. What about cigarette smoking? Does that affect transplantation?
Sure. Cigarette smoking does, because it puts you at risk of coronary disease, lung infections after surgery. I'm sure folks here, if you're going to do any major surgery, your doctors will tell you to stop smoking, because it also puts you at risk of developing clots in your legs after surgery. So we tend to tell our patients to stop smoking and get them counseling or help them quit smoking before transplantation. And it doesn't affect the liver directly, but it can affect your survival. You get a bad infection with pneumonia after a transplant when your immune system is down, you'll not make it, or you might have problems with clots and heart problems down the road. Most of the medications we use after transplant, like steroids or Prograf, causes more atherosclerosis. It causes hardening of the arteries. So if you're smoking and you're already doing that, and we are going to do more to you after transplant, then you might do well with your transplant, but you get a heart attack a year later. That doesn't help anyone. So we really want people to quit smoking.
Okay, it's a two-part question. What is the ideal ALP number, and is there a difference between labs? Quest lab report versus Lab4 versus an independent hospital?
So the question is alkaline phosphatase, which is one of the liver tests. It differs from the reference point of your lab. So if your lab normal is up to 110, then 110 is normal for that particular lab. Another lab might have 120 being their normal. So you really need to know the reference range of the lab you're using to determine how you're responding. And most times, a good response to URSO, for example, as a first line, the alkaline phosphatase should be diminishing with time, and hopefully less than 1.6 times the upper limit of normal. And if that's not the case, then you might need to think about second-line agents like a new agent or obeticholic acid as an adjunct or combination therapy in that particular patient.
Our last question. Somebody in here really likes you. Besides me. They would like to know, are you accepting new patients?
Well, certainly we have a big practice, and we'll be happy to help. I have a partner and a nurse practitioner, and we definitely will be happy to help them.
Wonderful. We've got a few things up here. We need a little housekeeping. Just
Sure. Okay.
Thank you. Don't go anywhere yet. Don't go anywhere yet. We would like to thank you and present you.
Thank you. That's nice. Thank you.
I hope that everyone, before you leave, don't go anywhere. Hope everyone did get a lot of benefit, a lot of questions answered. A little bit of housekeeping. This is a last call for tonight's dinner sign-up, and anyone that is signed up, we will try and find one person from that group, 6:45 in the lobby to go together. Please sign up for tomorrow evening. We will break from here shortly, and the friends and family section will be back in the San Felipe room. Go to the second floor. Sharp right, sharp left, left. Prior to that, we have Lenny that will be... Okay, you guys know where you're going. That was a test. We have one more thing for Dr. Ankoma-Sey as soon as Allie is finished. I would like you all to join me in singing happy birthday to him. His birthday is tomorrow. He is kind enough to be here on his day off, and we would greatly appreciate your help in thanking him and wishing him a happy birthday.
Thank you very much.
Happy birthday to you.